6 of Canada's provinces are leading the way. Alberta has the most active cases per capita now at 323. Ontario isn't far behind with 223. And more than 4,400 new cases were reported in Ontario today, adding to the already enormous strain on hospitals. Record numbers of COVID patients need intensive care. Hospitals in the Greater Toronto Area have been told to close their pediatric units to free up space and staff. Elective and non-urgent surgeries are being postponed. And that may not be enough. The situation in Ontario hospitals has never been more dire. Mike Drolet has our top story tonight.
For months, Ontarians have been warned a third wave of COVID-19 could be the worst one yet. And there's no denying the rise in ICU cases. Over 2/3 of the over 600 patients in hospital are on ventilators, leading to the difficult decision to cancel all elective surgeries.
It's the right decision. Right now in our hospitals, we really have no beds.
That means only emergency surgeries for things like heart attacks or trauma will continue. Joint replacements, cataracts, even cancer surgeries have been put off until the COVID cases decrease, leaving patients with chronic pain at home waiting. Beth Perfect, who suffers from debilitating back pain, had been bumped to the top of the list for spinal surgery.
Just over a year ago, I started to get radiating leg pain that's extremely intense, and that radiating leg pain has become unbearable.
She got the call last Friday. Her surgery was on. 2 days later, another call. It had been canceled.
It's overwhelming how emotional it is. It really is a roller coaster of emotions because there isn't any relief from the pain, but the thought that a surgery can make that pain go away and then to have that sort of snatched from you, you know.
Ontario has yet to make up for the surgeries canceled during the first wave, and the backlog of over 250,000 surgeries could take years to clear up.
It's going to be a very long road, and trying to just as quickly as we're revving down, we also have to appreciate how much work and effort it's going to be to rev services back up and try to catch up with all those canceled surgeries.
Many of the doctors and nurses who perform those surgeries are currently working in ICUs with COVID patients. The system, say healthcare workers, is straining to keep up.
I mean, if the alarms have not been sounded, like by this point, maybe this will sound the bells for people to really understand what's going on, because I can tell you it's getting frustrated when people are complaining about schools being closed and businesses being closed and restaurants being closed. Like, I think people really don't understand the situation that we're facing.
Given the rise in new cases, not enough people do. Mike Drolet, Global News, Toronto.